power blackouts, but we'll get on with it. Good afternoon and welcome to today's briefing. This is our 126th briefing, the National Emergency Response Committee on Coronavirus. The COVID-19 figures are on a steady rise, and that is likely to be so for a while. However, we have observed, after going through our data, including the data that we will share with you today on mortalities, that we are witnessing majority of the deaths in patients who have underlying issues such as diabetes, hypertension, and HIV/AIDS, amongst others. And we want to address the issue of HIV/AIDS today and its correlation to COVID-19. In Kenya today, out of all the HIV positive people who have been confirmed to be positive, 96% of them are on life-saving treatment. And more than 90% of those on treatment have controlled the HIV virus, therefore posing very low risk of transmission for HIV. We have further evidence that there is a decrease in the new HIV infections in the country to a mark of about 36,000 in 2018, which is really a stark reduction from our 2012 figures that stood at 100,000. And this is notable and remarkable. And indeed, Kenya is on its way when it comes to achieving epidemic control. And currently, in Kenya, we have 1.1 million people who are benefiting from antiretroviral treatment. Again, a remarkable achievement and a testimony to the strength and the resilience of our HIV program. And this progress can be attributed to many factors. Amongst them, primarily, an excellent partnership with bilateral and multilateral agencies, the use of a multisectoral response, and a strong health sector leadership and strong political commitment, all of which have contributed to this success. However, as we celebrate this success, we need to be aware that COVID-19 poses a challenge to the uptake of HIV testing services, particularly due to the low outpatient hospital visits during this period. Yesterday, we articulated that we've seen a drop in outpatient visits by about 30%. And what this means is that majority of our people are no longer visiting health facilities for HIV testing services, and therefore there's a decline in knowing the true status when it comes to HIV. The lowest uptake was particularly noted in the month of March and April, where we had testing volumes reduced by up to 33%. On the other hand, we also note that community testing has also reduced by 71% when it comes to HIV care. We have noted that HIV pregnant mothers do continue to attend their ANC clinics, and there's been a slight impact of COVID-19 to this statistic. And so it becomes important really today to focus on this condition, noting the gains made in the country, but emphasizing that we do need to pay attention to ensure that we don't lose on the results that we've gained. Ladies and gentlemen, we have an upward trend in the number of clients newly enrolled in antiretroviral therapy between January to July. However, even as we enroll these clients, again, due to COVID, there is a problem when it comes to these clients being able to get their ARV treatment. And we've seen a decline, again, when it comes to refills for these medications. From available data, the 1990 targets indicate that 83% of HIV-positive clients have been identified, 87% of whom are enrolled in care, and 93% of those who are enrolled have achieved viral load suppression. And perhaps to define this further, 1990 is a global strategy, one that Kenya has signed on to, and you can see how we are performing when it comes to the three measures of the 1990. Right now, we have 83% of HIV-positive clients being identified. We do fear that COVID-19 may actually reduce this percentage. Of those that we identify, we have 87% enrolled in care. And again, a concern here, because being enrolled in care means that you're attending your clinics and you're getting your prescriptions. And again, with COVID-19, this is bound to be affected. And then, of course, 93% of those who are enrolled achieve viral load suppression. And how you achieve viral load suppression is by taking your medications. And because of COVID-19 and reduced OPD visits, we are fearful that, again, these indicators that we've achieved may actually go down. So even with the emergence of COVID-19, as government, we continue to put in place resources to ensure that lab testing for HIV is available. Taking note that as we test for COVID-19, the very same test that is the gold standard of COVID-19, that is the PCR test, is also the very same test that we utilize when checking for HIV viral loads. And so what we've done, we've been able to look at our mechanisms and our framework, our logistic framework, to ensure that HIV testing continues on and that we're able to provide these two services when it comes to testing. With regard to our COVID-19 situation, today we have 667 positive cases out of a sample of 5,075 in the last 24 hours. And this brings to total the number of positive cases in the country to 16,268. And our cumulative cases stand at 266,102. From the cases, 657 are Kenyans, whereas 10 are foreigners. 393 are male and 274 are female. And the youngest one is a 1-month-old infant, while the oldest is 92. And in terms of distribution by county, we have Nairobi leading at 387, Kiambu at 40, Mombasa at 26, Machakos 47, Kajiado 79, Nakuru 15, Uasin Gishu 14, Garissa 11, Busia 9, Kilifi 6, Turkana 6, Makueni 5, Wajir 5, Kisumu, Nyeri, and Lamu having 4 cases, Murang'a 2, and Bomet, Bungoma, Narok, Nyamira, and Vihiga having 1 case each. And again, we've provided a distribution when it comes to sub-county disaggregation. And for Nairobi, again, today, we have Dagoretti North leading. Yesterday it was Kibera. Today Kibera is second at 32. We have Westlands having 32 cases, and Embakasi East having 30. And the situation continues in each of the counties, with the hotspots leading in terms of numbers. Again, to mention a few, in Machakos, Athi River remains as the lead with 41 cases. In terms of Kiambu County, we have Kikuyu having 13. We have Kiambu having 6. We have cases in Gatundu South, Kiamba, Lari, and Ruiru having 4 cases. And in Mombasa, Mvita again leading with 13 cases, and Jomvu having 9. And we've provided for you the disaggregation by each county, by each sub-county, with the highest county to the least county. On a positive note, 311 patients have recovered from the disease, and out of this, we've had 166 from the home-based care program, while 145 from various hospitals. And this brings the total number of recoveries in the country to 7,446. And we continue to thank our healthcare workers for this achievement. Unfortunately, we've lost 11 patients from this disease, bringing our fatality to 274. And what was striking for me today as we reviewed this mortality data is that we've actually lost a child due to rickets. And I found it necessary to really highlight this today because even as we impose physical distancing, even as we say stay at home, then it means that if our children are staying at home, particularly those who live in apartments or areas where there are no fields, then it means that there's a risk when it comes to rickets. And how to take care of rickets is to ensure that your child has access to vitamin D, which is best sourced from the sun, and a healthy diet. And so the fact that for the first time we've actually had a fatality and that this child had rickets really is a cause for concern. It means that we need to relook to see as parents, even as we have our children in the houses, How can we ensure that there is an element of sun exposure and, of course, healthy diet? We continue to pass our sincere condolences to the families and friends of those who've lost loved ones during this pandemic. And finally, we would like to reiterate that our health facilities countrywide continue to be operational for treatment of all other diseases, not just COVID-19. And therefore, we appeal to people not to shy away from utilizing services, and this includes the HIV testing services that we've discussed today. We have seen a decline in terms of service utilization, and we do continue to remind you Kenyans that if you are unwell, you should go and seek care at the health facility. Our healthcare workers remain ready and willing to attend to all ailments and not just coronavirus. So let us make use of these facilities. Thank you.
Dr. Ali, my name is Elfas Legat from Citizen Television, and my question is on the increase of caseload. Especially the last 3 weeks have particularly been revealing in terms of numbers of positive cases. Where are these numbers from? Are they targeted mass testing, or is it contact tracing? And again, we understand that there are government institutions that have ordered their staff to be tested. If you can kindly give us a breakdown of the same. And also in terms of facilities, hospital facilities, with the numbers, you've mentioned before that in the coming weeks, the numbers will peak. How are our capacity in terms of hospitals to handle these rising numbers? And also, Daktari, there is the aspect of stigma regarding the people who turn out positive, and reluctance, particularly from officials from government, to reveal their status. Have you deliberated on this new emerging trend of stigma for particularly patients who've turned out positive? Thank you.
Thank you, Mark Namasa from KTN News. My first question is, I've received a call from a female patient at the Kenyatta University Referral Hospital, a COVID-19 patient. She says she was admitted together with her 3 children, so there are 4 family members there. Then, about a month ago, and then yesterday, one of the children tested negative and wanted to be cleared to go home. The child was told to pay some 90,000 shillings. So when she does her mathematics for 4 family members, if they all turn negative, then the hospital wants close to 400,000 shillings from her. So my question is, when did government decide that people who have been admitted in government facilities will now have to foot their own bills? They claim it is accommodation fee at the rate of 3,100 per day. My second question concerns people who drop down dead. When does government decide that these are COVID-19 cases? Does government go to the step of testing these people who die mysteriously and confirm it is a positive COVID-19 case? Thank you.
Oh. My name is Eunice Omolo from NTV. I have 2 questions. The first one, how many people actually need hospitalization in the country in regards to COVID-19? Or rather, how many people have been hospitalized? Then my second question is in regard to the NMS. They have a plan to set up 24 hospitals in 4 slums in Nairobi in partnership with the Ministry of Health. How much has been set aside for that, and how soon is the project intended to start? Thank you.
I think I can see one more hand from Purity, who is Zalendo, so go ahead.
Thank you. Good afternoon. I have concerns, a follow-up on the HIV status. You said that 96% of people living with HIV who are COVID positive are under some sort of support, life support. Would you break the numbers for us? How many have tested positive, and maybe how many have succumbed to this disease? And then the other concern is you've occasionally talked about the surge or the peak, the projected peak to be around early August or even up to September. What is the level of preparedness in terms of capacity, in bed capacity, and even in counties? Lastly, you've also been talking about utilizing the community health workers. Most of the times, these healthcare providers do some sort of charity work with no pay, volunteering. So is there a budget for them, or how are you planning to make use of them?
Thank you. Thank you all for your questions. I think I'll start with Elphas's question from Citizen, where he has asked, where do we get our numbers from? And I think this is a question that has arisen during past several briefings. And related to this is then the question of, are we testing any government institutions? And if we are, which ones are we testing? And can we release those results? What I'd say is that in terms of our testing strategy, we've often, informed you that in national government, the testing emanates from what is known as our Emergency Operations Center. Our Emergency Operations Center is situated at Afia Annex, and I'd really invite you, members of the Fourth Estate, to perhaps also feature that center, because that is the nerve beat of this COVID-19 response. And in that center, we have what we call rapid response teams, and that is where these rapid response teams are dispatched from. So when we get an alert either here in Nairobi or an alert in the counties, that alert is transmitted through the 719 number to the Emergency Operations Center, and their teams are dispatched to be able to either go collect the sample, if it is here in Nairobi, or to coordinate with county rapid response teams, of which all counties have been able to put together rapid response teams. And once these teams are alerted, they then, of course, go to the incident area. They're able to pick a swab, take the tests, and they're able to also initiate contact tracing. So that is how we get our numbers. One of the other ways in which we're able to get our positive cases is in cases where we are conducting targeted testing. For example, testing of healthcare workers, testing of other frontline workers, people in security, testing of different government institutions, most recently the courts. I'm sure you saw that story in the paper. So then we go in there and we conduct testing. Yes, there are various other government institutions that have undergone some form of targeted testing, especially when we have traced a contact to that area. And so this is an ongoing situation that's evolving. And in terms of releasing and sharing with the public, there are mechanisms. The contact tracing mechanism is one of the mechanisms in which immediately a case is identified or a cluster is identified, then the measures needed are put in place. With regard to capacity of our hospitals, and I really want to link this up with Purity's question on, we've talked about our numbers going up. Are we ready? Do we have capacity? Yes, as it stands, and Dr. Kuria will elaborate on this. When we look at our beds, I think Kuria did give a brief recently. We have about 12,000 beds across the country, and the number is still building. Every day, counties continue to increase the number of beds. When it comes to ICU care, perhaps an issue that has really been highlighted in media, an issue in which we've gotten numerous phone calls on. Yes, in Nairobi, there are days when our ICU beds have been full, but remember, across the country, we have about 400 ICU COVID beds that are available. And so in terms of our assessment, we are not yet overwhelmed. We're still under the threshold of raising the alert level. When it comes to stigma, we've spoken to this several times here in this press briefing as individuals. I think we've seen different people, share with you how the testing procedure is done to allay any fears when it comes to testing. And those who
Explorers of the night, wale wase wa kuhustle usiku, kustreama movies, music mix diehards, and gaming fanatics. We've heard you. It is now your time to fly your flag high. Do what you love, mpaka che na Telkom. Join Usiku Sako with Telkom night bundles that allow you rule the night at prices you love. Join our tribe, Usiku Sako Squad. Just dial *544# from your Telkom line and select the night bundle of your dreams. You are the legend the night needs.
Welcome to Michuki Park.
It's a story of nothing is impossible.
Hiyo ilikuwa baya, wakora wengi, ilikuwa yote, security ilikuwa baya.
A nation that ignores its environment has no future.
Yes, Michuki's dream lives on.
We are expanding the green areas in Nairobi.
From a dump site to a world-class recreational site.
We were able to clean the river of solid waste.
This is your environment. It's not somebody else's environment.
This place is now totally safe and secure.
It feels so good to be able to bring back life.
Michuki Park Restoration, what it means for Kenya and the link with smart cities. A Chams Media production this Sunday at 6:30 p.m. on NTV.
This week on Tuzidi na Hustle.
Maybe you can try make a cuff, another cuff.
Unajisikia umekata hiyo kitu kweli?
Sijakatika.
Umeipenda? Hujata nini yakikauka.
And there is our handcuff. Yeah. Robert, unaweza tengeneza kama hizi ngapi na day?
In a day natengeneza kama hizi
30 a day.
Alejandro Fisi.
This week on The Trend.
Fisi. Pima miti utajua ni amuloja. Kitu safi and chain.
Chris Kaiga on the chain mood.
I give you my heart and soul.
All the way from Ghana,